Good afternoon. And today we have an honor to interview very famous person who famous on social media. This is Dr. Mark Burhenne, but a lot of people know him as Dr. B and his channel called Ask the Dentist. So today we're going to ask the dentist. Good afternoon, doctor.
Good afternoon. Glad to be here.
And thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, this program is going to be for you because sleep apnea significantly affects general health as well as oral health. And if you're a medical professional who, just like us, trying to connect the dots to have a full picture of health or trouble with sleeping for the patients and want to find the solutions to make patients to sleep better, this program going to be great addition to your waste of knowledge. And regarding my personal story with Ask the Dentist, yes, I heard about this channel Ask the Dentist, and for me, being a dentist for so many years, I also find a lot of valuable information what Dr. B posts on a regular basis, especially connection of oral health and systemic health, and talking about fluoride. That's a very hot topic, in a time of the new administration. And I recently published the article on Forbes about that, and also about very controversial topic of a mouthwash. Dr. B posts on a regular basis, and sleep, and colon cancer, and Alzheimer, and we find out his opinion about that today. So we, after hearing about, learning about that topic, I was so excited to meet him on a conference in the summer, American Academy of Systemic Connection, and he, I guess, follow the same principles as this academy. So that was wonderful what he agreed to come to our channel and personally share his knowledge. And I'm gonna give you, short glimpses of his bio. He's a dentist for 35 years. And not only he established patient-centric and systemic health dental practice, he's also trying to spread the knowledge, and I would say change the stigma of relationship towards the dentist. He's a TEDx speaker, and he's been on multiple outlets, CNN, NPR, Huffington Post, Mind, Body, Green, Men's Health, and he created Ask the Dentist, and now anyone can ask him questions. He's famously known as a Dr. B. But in addition to that, he also have his own line of product called FIG. And I like the name acronym of the name said feeding your good guys. So he wants to promote good microflora with his products. And, he's lecturing, and he's doing a lot of wonderful things to make people around him or people who listen to him to be healthier. So my first question to you, what inspired you to start the channel, and what's the secret? What make your channel so popular? Because we're all fighting for attention of our audience, and some people like you succeed, and some people just keep trying.
Well, I think there are a lot of people, thank you for that introduction. There are a lot of people that are succeeding in this space. I think our success is that we were one of the first. ATD, Ask the Dentist, my daughter and I founded about 12 years ago, and we've been around for a long time. What made that happen? I think the short version of that is that my daughter, who had worked at Facebook, Google, Twitter, she has a lot of SEO expertise. She, before that, had worked at my practice, at the family practice in Sunnyvale in the Silicon Valley. And, she was during the summer, she would work the front desk, and she was listening. She would overhear things. And I think a few years later, when she became a young adult, she essentially, I mean, she would even hear phone conversations that I would have with patients when I was at home. And she finally said, "Dad, your message is very unique." I'm not sure how she figured that out. I mean,
Smart.
her N of one was just her dad being a dentist, but she said this message has to get out. And, she had many choices. She could have spoken to her mom, my wife. I mean, she has fascinating past experience in tech. I mean, but she thought this message needed to get out. And so I very reluctantly became a oral health care influencer. And my daughter really was the one who started the whole process. And once I realized that there was an audience and that the feedback was really very, very positive, and then I realized this is something I need to run with and get the message out. And as you know, and as many followers of Ask the Dentist know, the message is slightly different in some areas than
Standard.
right. So that's, I mean, it's the democratization of healthcare. We've got the internet with all its pros and cons, and one of the pros, of course, is that a message that needs to get out that maybe is being suppressed in some way for several reasons, we can talk about that later, it can get out to the public, and the public eats it up. They love it.
No, but that's wonderful. It's give freedom of speech, a little bit different view.
Right.
I would put it that way. And we're going to talk about the messages, what you bring up. And I'm going to ask you, like the first one of you being a dentist, tell me what's so terrible about separation between medicine and dentistry, and how you fighting that separation with your experience in dental sleep medicine, oral appliances, and who do you think oral appliance would work for the best?
Right. Well, there are many examples of this separation. I call it a schism or a chasm between dentistry and medicine. And it has a historical past. We got kicked out of the club. We were all in one club. And I think in 1839, we got kicked out. It's a long story, but, and ever since then, we have worked alongside medicine, or they've worked alongside us, but we really haven't connected very much. And physicians still think the mouth is just something, it's just hard tissues, it's carpentry. We just drill and fill and that's it. And that's one of the kind of prime directives of Ask the Dentist, and has been for the last 12 years. Not the case. What happens in the mouth is affecting what most physicians are dealing with in terms of chronic diseases, whether it's colorectal cancer or Alzheimer's, high blood pressure. Most chronic diseases have some connection to a bug in the mouth. And, it's really quite shocking that message has taken this long to get out. Again, it's 2025. Medicine and dentistry has been doing very well and has had a lot of research and success, and for at least 70, 60 years, maybe longer, depends on how you define that. And now this message is just coming out. To me, it's mind-boggling. And if I think back to my education, that's what it was. It was all hard tissue, removing bone to get teeth out. There was some pathology and physiology with gum disease, periodontal disease, but there was no connection ever made beyond the mouth. And I think I know that physicians get the same education, that the mouth is just over there, just ignore it. If you're an emergency...
That's for dentist.
Yeah, exactly. If you're an emergency room doc, you're going to see a lot of abscesses, periodontal abscesses, and you're just going to refer to a dentist, and you're going to probably just give an antibiotic, and that's it. But what they don't realize is that there is a connection. I mean, I have so many examples, recent examples. It happens almost daily. A loved one in New York, actually, a young woman has an ulcer, and she's getting tested now for the H. pylori via oral microbiome testing. That bug that causes the ulcer is in the mouth. It's always there. And of course, the mouth is spilling, all the bugs in the mouth spilling.
Wow.
Another family friend, and an accountant, bookkeeper accountant, has rheumatoid arthritis and was admitted to the hospital for fluid around the lungs. And what they didn't realize until I pointed out to them that there's a connection between rheumatoid arthritis and AFib. And then they worked her up for telemetry, and lo and behold, AFib, she has a pacemaker. Now she's feeling better. I mean, it's just every day I get this kind of
Messages.
Yeah, messages, but also this reinforcement of the mouth is causing a lot of mayhem. And if we ignore the mouth, then you essentially, and you're in the gym working out, and you're taking vitamins, and you're trying to do your best and eating well, you're still not going to be healthy until you address
the mouth. No, I would say, no, like I like to put them like a little raindrop, what eventually gonna make the pavement, make the road through, like a true road or whatever. We can put it in a philosophical way. I would like to talk to you about colon cancer. That's the problem what for some reason become so devastating among the young patient population. And as a dentist, what's the connection? And I want to mention to my audience also about, we are also very much encouraged or inspired by salivary testing, what we're offering to our patients right now. And based on that, we can connect a lot of dots to systemic disease. And Dr. B, he advising for, salivary test company, Bristle, and that's a great new chapter of dentistry. I'm very inspired by that. So I want to ask you about colon cancer.
Right. So no, I'm glad you mentioned salivary testing. We should talk about that, because pretty much everything we're going to talk about, or that I talk about, one of the first things you want to do is test your saliva. And there are many tests out there. They've been out there for a while, but it's only one test that's testing for all the bacteria in the mouth. And we can talk about that. I have a box here. And I'm glad you're excited about it, because we need to get more dentists excited about it. I tell patients all the time, don't see your dentist until you've tested your saliva. Now, your dentist may do that for you, which would be ideal. But if your dentist isn't doing it, just do it on your own. It's important. But colorectal cancer, yes. Oh, my goodness. Definitely in the news. I know a lot of young people, Gen X, millennials, that are asking me questions on Instagram, probably over 100 questions a day from that group. And I'm so glad that they're asking. They're wondering, what is this oral connection that I'm hearing about? That's if they've heard about it. And maybe they're not getting this information when they're scanning the web or from their physician. Medical science is looking into it. A lot of it is ultra processed foods. Again, everything we're talking about is not just because of oral involvement. It's multifactorial, but the discussion needs to include the mouth, because a lot comes from the mouth. It can start the issue. These bacteria that are in the mouth that cause or are related to the colorectal cancer are found in the tumors themselves. And so let me just discuss how this connection occurs. So we have a name for it. It's called the oral gut microbiome axis. So the oral microbiome and the gut microbiome, biomes are really big news now, of course. We've only known about them for about 20 years or less. And the oral microbiome is second in diversity. Actually, it's more diverse than the gut microbiome, but it's second in size, but they're connected. And remember, the oral microbiome comes first, and everything that happens there gets dumped into the gut microbiome by saliva, but not just saliva, through the bloodstream, through many other ways, indirect ways, like metastatic injury, inflammation, but also via the gut itself through saliva, and also through the bloodstream. Absorption of a bug through the gums, leaky gums, you could call them. Could be the oral mucosa, but it could also be gum disease, into the bloodstream, to the brain, to the gut. And of course, this bug affects the permeability of the gut membrane, which obviously is a big deal. There are many things that affect permeability of the gut, and permeability of the gut is what we need to worry about. Some permeability is important. The gut is pulling things out of our food, but too much permeability is a problem. So we call this, the first thing I was talking about was bacterial translocation.
Mm-hmm.
Via the oral mucosa, periodontal disease. The bug that we're talking about is Fusobacterium nucleatum, the F nucleatum bug, and this is what's being found in these tumors. So an overgrowth of pathogenic bacteria in the mouth, which most of us have, I would say the majority of us in this country have that, and we can talk about why that is. It leads to a dysbiosis, which influences the inflammatory pathways and tumor development. So there's a bug. The take-home message here is that there's a bug in the mouth that is more prevalent now for a variety of reasons. Could be diet. It definitely is diet. Could be mouth breathing. Could be many things that alter the and affect the oral microbiome. Is related to this rise in colorectal cancer, and that's not a good thing. And young people shouldn't be getting this. I mean, this is something new. It's usually a disease that comes in time. And anyway, there is a connection, and it can start in the mouth, certainly.
Like this is a great message to start in the mouth, but I would say mouth is a very easy area to test. I think that's the central message. What you do saliva test. It's not invasive. It's very simple. You do it, you send it, and you have a full composition of your microbiome. And if pathogenic bacteria have a very high concentration, wake up. Wake up. You need to become a Sherlock Holmes of your own health and
Right.
look for trouble. Otherwise, trouble's gonna look for you. If we put it that way.
Testing once a year. This test that we're referring to is the bristle test.
Yeah.
This is the company I work with. They reached out to me, but I always like to say I chose them because I get a lot of offers on who to work with, 10 to 20 a day from all over. And I only work with maybe over the last 12 years with maybe, well, 2 companies on an advisory basis, but in terms of affiliates, maybe 20 companies. I'm very picky. In fact, I sometimes drop affiliates. I dropped it was a very lucrative affiliate, but I dropped it. It was an electrolyte company. I've dropped water filters because I found out that the filter itself, which was good at filtering fluoride, but also was introducing microplastics into the drinking water. So my point is that there's only one test out there that I think is worth taking. In fact, the young lady in New York who has this ulcer is sending her results in. The key here is to test yearly or monthly. It depends on what's going on, and find out if you have a dysbiosis. Find out what your baseline is. Even if you're healthy, find out what your baseline is. Everyone's got a different flora and biome, especially in the mouth, because there's so many variables compared to the gut microbiome. And then if there's a change, nip it in the bud. And instead of finding out later that you've got colorectal cancer, find out if that bug is elevated or if you have a dysbiosis of the oral microbiome. That's an easy thing to do. Insurance should be covering that. Dental insurance should be covering that. Dental insurance is a crap product. It's a benefit. It's not insurance. Medical insurance should be covering oral microbiome testing yearly, just like they should be verifying and testing sleep. Home studies, maybe. Because if we catch these diseases in their prodromal phases, we save a lot of lives, which would be nice. But the real driver will be we'll save billions of dollars in healthcare costs. And there are a lot of countries that do test. Iceland tests yearly for sleep apnea. Now, I know that's a small population. I think Italy does the same thing. I mean, they're testing for it. Whether or not you want the test, they're looking for sleep apnea. I think that's wonderful.
I think so too. And now I want to ask what not a lot of people know about magnesium and health. That's going to be my last question. Please tell me why magnesium is so essential, and it can be for general health and for sleep health. Why is that?
I'm really glad you asked that. It's something that doesn't come up very often because it seems like such a trivial topic. It's like, it's a mineral. I mean, and it's been overlooked. And I got excited about magnesium about 4 or 5 years ago. And it kind of, I mean, I've been a healthcare nerd reading about longevity and supplements since I was 17 years old. And magnesium was always in the multivitamin. But we're drinking a lot of bottled water, a lot of filtered water. Tap water is terrible. Our environment is very low in minerals because the soil is just depleted. We used to breathe in these minerals. Our ancestors would walk through a field and they would be breathing in minerals and drinking it from natural water supplies. Why are minerals so important? Let's use magnesium as an example. Magnesium, as our minerals, and I'm just talking about overall, I'm talking about oral health as well. But magnesium is involved, and again, I'm a biochemistry major, and I saw this very early on. Magnesium is involved in every cellular process. Cell that makes our tissues and our metabolism and our physiology runs on magnesium. Without magnesium, we're not going to get things past the cell wall back and forth. Communication, transportation. As far as so, for low magnesium, I mean, our heart may not work well. A lot of things go wrong. Let me talk about some of those. So let's talk about bone and teeth and the mineralization. Magnesium is essential for bone density as well as tooth density. So when your tooth is trying to mineralize, if you want the ionic integrity of your saliva to be just right for remineralization, you need magnesium in there, as you do phosphate, boron, even things like that. So there's an impact on tooth enamel, especially when you're developing as a child. Tooth organ is forming. That you want strong teeth. You've seen many dentists talk about, oh, this person had soft teeth, this person had.
Yes.
I mean, there are different types of enamel formation, and some teeth don't form very well. And there's also a relationship between vitamin D and calcium. You need magnesium. It's a cofactor for vitamin D. You're taking a lot of vitamin D, but if you take magnesium, you're not getting that converting of vitamin D into its active form in the body. So for adequate vitamin D levels, you need optimal, that helps calcium absorption. You need the magnesium on board. It's a cofactor. Gum health. How does magnesium affect gum health and periodontal disease? It's the inflammation and immune response. Typically, gum disease is an overreaction. It's a cytokine response, and it's pretty prevalent. After age 45, I think 70% of the population has gum disease. Most of our young people, I would say almost 50%, have some form of gum inflammation, of gingivitis. But magnesium is involved in modulating the inflammatory process and making it work properly. Chronic low-grade inflammation has been linked to periodontitis, of course. So you definitely want magnesium on board. Also, it helps with tissue integrity. Healthy gums need minerals. And again, this probably has to do with minerals being responsible for every cellular process, including healing. Collagen helps, of course, too. Magnesium has a big influence on saliva and pH. We've talked about that a little bit. You got to have that. You have to buffer the pH of saliva. The oral microbiome works well in a certain pH range, and the minerals help buffer the saliva. The saliva is basically the building blocks of biofilm and pH regulation and swallowing and swishing and getting all the ingredients to the teeth and to the tissue and all of that. Dry mouth is not a good thing. What else? Obviously, magnesium is important for other things, chronic fatigue, muscle cramps. But if you're low in magnesium, you can suffer from increased cavities, sensitive teeth. We talk a lot about that with our toothpaste. We talk about this ionic or this mineral integrity of saliva, and it's very difficult to get in our environment. So yeah, I mean, magnesium helps with sleep. Oh my God.
Yes.
Oh my God. I mean,
So good what you mentioned.
Oh, what would I mention?
The sleep. And I would like to ask you, for our audience, what would be, how to define the supplementation of magnesium? How much person can get it and be in the safe zone?
Right. That's a great question. So I'm just going to make it simple. I knew I was going to be asked that question. So I take this in the morning. It's just one form of magnesium. It is essentially magnesium threonate. It's for the brain. Brain needs that first thing in the morning. And then before I go to bed, I take 7 different types of magnesium. This is a company. One company can't do it all. And this I recommend to all my patients. It's one of the first things I recommend is 1 hour, 2 hours of sleep, not right before bed. Take the magnesium. And why? I mean, first of all, it helps calm you. It helps calm you down. Magnesium has that effect. Stress management. Also, magnesium intake is important with sleep hygiene. Obviously, you want a dark room and all that, but supplementing with magnesium helps. Muscle cramps, fatigue and low energy, difficulty sleeping if you're waking up a lot during the night. It has a calming effect. It will help you fall asleep. Again, it's that cofactor role, but in this case, it would be a cofactor not with calcium metabolism, although that's going on too. It's a cofactor of GABA, and a lot of people take GABA for sleep. It also helps with melatonin. Melatonin is the key to sleeping well. It controls that time clock of when we go to sleep, when we wake up, and all of that, the circadian rhythm. So, and a lot of people have restless leg syndrome. There are not a lot of good studies on magnesium intake and RLS, but it's worked. It's worked for my patients, probably in conjunction with many other things. So
thank you. Thank you very much. You gave us so many practical advice, and I highly recommend my audience to check your channel on Instagram, Ask Dentist, and you have a lot of great information. So thank you very much, Doctor.
Thank you, Maria. It's always a pleasure to be able to talk about these things.